Hello, this is Dr. David Green with the California Pain Network. Today's topic is what you need to know about acute and chronic back pain. You know, people write books about back pain. They give lectures and big time series. I'm going to teach you what you need to know in 4 minutes. All right, let's go. The facts on back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of it gets better within 6 to 12 weeks. So the odds are in your favor that no matter what treatment you get, you're going to get rid of the pain. But there are an unfortunate few who end up with chronic back pain. So the definition of acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and chronic is when you have pain for over 3 months. It's the second most common reason for doctor visits. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect cost of back pain annually is $100 billion. It's probably a lot higher than that, but it's hard for people to figure out that indirect cost. All right, so what are the causes of back pain? There are soft tissue causes, and there are hard tissue causes, like fractures. So for soft tissue causes, far and away, the most common cause of back pain is a back sprain or strain. Think about those times that you've been moving and you try and lift up a box the wrong way, and your quote back goes out. All right. Now we're talking about a back sprain or strain. Here's a normal disc on the left. The best way I can describe it is as a jelly donut. Soft jelly in the middle, harder on the outside. This is called the annulus. This is called the nucleus. There are some nerve endings, and pain can be felt on the outer part. You can't feel any pain in here. There's no nerve endings. This is looking at it from the side. So degenerative disc, normally you have a healthy disc like this with nice height to it. There's a lot of water in it. It's about 80% water. When you start to lose that water, you can start to degenerate on the disc. You can start to get some tears in the outer part here and some pain. Okay. Now a bulging disc. Here's a tear actually right there. As you start to lose height in your disc from lack of water, it can start to bulge. And the best example would be as a tire that's getting flat starts to bulge. You've all seen that, right? It's the same thing that happens in the disc. You start to lose water, it starts to bulge out back, and you can start to get, looks like a flattening tire. This one just has tears in it from degeneration. If it actually gets a tear and the inner part, the jelly, squeezes out, then you start getting a disc herniation, and it can push on a nerve root as it's trying to get out, from the spinal cord. Sciatica is pain that goes down one or the leg or the other. It depends on which nerve root is being pinched, okay? It depends on where the pain goes. But here's the same thing. You have a disc herniation here. Actually, this is a bulge. There's no jelly coming through. But even the bulge is pushing on a nerve root, all right? So this can cause back pain, and if it pushes on a nerve root, then it can cause sciatica pain going down the leg, okay? Here's a herniated disc looking backwards, and it pushes on a nerve root which is trying to come out towards us. All right, moving into the bony causes of back pain. First and foremost is arthritis, by far and away. What happens is, as we get older, we're very good at making bone, okay? So when you start to lose cartilage in a joint and you can't make enough cartilage to keep it filled with cartilage, the body says, you know what, I can't keep up with this, I'm going to make more bone. We don't want it, we don't need it, but it does it anyway. And that bone can start to pinch on things. It can start to pinch on nerve roots. It can start to cause back pain. So that's the number one cause of bony cause of back pain. You can also get arthritis in your sacroiliac joint, which is a joint just over in the sacrum, or in the buttock area. You can have scoliosis as an adult, which can be very painful both in the back, and it can also pinch on nerve roots as well. Let's go through these. Here's the SI joint. See how this one's red and inflamed? That's from arthritis. Here's a scoliotic spine. What you can get is arthritis in these joints, and it's asymmetric. So you start to get breakdown here, and it gets a curvature. Spondylolisthesis refers to slippage of one vertebrae on another, and that can occur due to arthritis back here, and that can actually cause significant arthritis in the joints of the back and back pain. It can also pull on nerve roots. You see this area here? That's where a nerve root comes out. Think about it. If this area here is being pulled forward, it can actually pull traction on a nerve root. Spondylolysis is a stress fracture in the spine. This is one view where it shows it, and it's an acute fracture of the pars due to stress. So this is just pars interarticularis. It's a fancy anatomic term. But when you start talking about spondylolysis, spondy means spine, lysis means fracture, so that's what that refers to. And then another spinal stenosis, as I mentioned, the arthritis and bony overgrowth here and here can pinch on nerve roots, and that is very, very, very common as an individual ages. Uncommon causes of back pain would include infection, fracture, or a tumor. Fracture is not so uncommon. I mean, a fracture of vertebral body due to osteoporosis, there's about 750,000 of those that occur a year in the U.S., so that's more common than you might think. I'm talking a fracture might be uncommon, like, from a car accident, okay? So there you have it, the 4 minutes of an overview of acute and chronic back pain. The California Pain Network offers the top non-operative pain management throughout the state with multiple clinics in San Diego, Orange County, LA, Bakersfield, San Francisco, Inland Empire. There's over 50 insurances that are accepted and over 25 treatment options being provided. The success rates are very high, over 90% overall at pain relief and avoiding surgery, and the treatment is provided by board-certified, award-winning pain doctors. Check us out on the web at californiapainnetwork.com, and the number to call is 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.